Dr. Kim Schrier. How many energy drinks did you consume over the course of 24 plus hours of the markup session?
Well, if you count coffee as an energy drink, only four, which is kind of shocking. But I did have two at home before I even went in. So I guess that makes it six.
Do you think you could briefly recap, Congresswoman, the outcomes or the big points from the markup session? What came out of that session overnight?
So here are the big top lines so that people know what this 26 and a half hour markup was. This is my committee's part of President Trump's, the big, beautiful bill. And this is the bill that renews his 2017 tax plan that is set to expire. And if people recall, this was a really big deal, kind of a scandalous thing then, because the vast majority, like 85% of the benefit, I believe, went to the wealthiest, like to the billionaires and to the giant corporations. And so it was really considered, generally not good and not fair for my constituents. But it also exploded the deficit by about $4 trillion. And so now it's time to redo it, and they're trying to figure out how to pay for it. And so one of the ways is lifting the debt ceiling, which will explode the deficit. But another way is getting into Medicaid and taking, in this case, it would be $715 billion, so three-quarters of a trillion, and shifting that from the most vulnerable people in our communities, kids, pregnant women, elderly people in nursing homes, people with disabilities, taking health insurance away from them and using the savings to give a gigantic tax credit to billionaires. That's the foundation.
And so the finding that was cited often by yourself and other Democrats in committee overnight was about 13.7 million people losing coverage nationwide. There are 2.4 million Medicaid insured people in the state of Washington and quite a few in your own district. So um, that particular number, do you think that's close to what would be the real impact, or do you worry it would be higher than that?
Obviously, I still worry that it would be higher, and we can talk about that in a moment. But those numbers came from the nonpartisan Congressional Budget Office. So they score all of our bills to see how much they will cost, how many people will lose insurance, those kinds of things. And that is standard before we decide to vote on a bill to know what the CBO score is. So that's a real number. But I want you to think about something else. That counts the people who are on Medicaid and then the Medicaid expansion that most states adopted with the Affordable Care Act that just like scooched the salary a little higher, but these are still people who are struggling to keep afloat. But then if you take away Medicaid and those patients still get sick and still need care, but they end up going to the emergency room for care for more serious illnesses because they weren't treated early, then we all wait longer for the emergency room. The hospital isn't compensated for that care. And how do they stay afloat? Well, they stay afloat by charging our insurance companies more, which means our insurance rates go up. And so we don't have data for this. I don't know if the CBO evaluated this, but you have to think, well, gosh, if people's insurance rates go up, how many of them are just going to decide, I just can't afford this anymore? So we don't really know, but I think of our healthcare system as like a three-legged stool, and Medicaid is one of those legs. And if you chop that, it destabilizes everything.
The concern there, I take it, is for the knock-on effects that we don't see when we just talk about a raw number like 13.7 million people. Each of those people has a ripple out into the system.
That's right. I mean, I'm 56. I have octogenarian parents. And there's a lot of people out there in that same situation. And if your elderly parents need to be in a nursing home, and 3 out of 5 of those seniors in nursing homes are covered by Medicaid, if they lose that coverage, then, the 50-year-old son or daughter has to leave their job to take care of their elderly parents. And what does that do to the economy and their family? I mean, it really can destabilize the economy if people do not have an ability to get health care.
These markup sessions are an opportunity for members to introduce amendments that are, close to their hearts. You have worked with other advocates for diabetic Americans toward insulin caps in various areas of coverage. Were you able to put forward anything like that during this session, and what was the outcome?
Yeah, I was. I sort of linked what we just talked about, which is that when you take away Medicaid from people, not only do they have to pay more for medicines, but if everything gets more expensive, then even people with private insurance will be paying more. And so, how about we try to give people with private insurance a break by making it so that their copays are no more than $35 a month for insulin. And every Republican in the committee voted no on that, even though we did that for people on Medicare, and it has been wildly successful, so appreciated in communities, and it has been not just life changing, but really life saving. Because if you're like me and you have type 1 diabetes, you cannot live without insulin. And it's a really big deal. I think they voted the wrong way.
One of the things that interested me about watching some of the markup session is you had a question to the chairman, Mr. Griffith of Virginia. How does this tactic make America healthy again? His response was something along the lines of encouraging people to work and have a purpose. Your response to him, I believe, was people who are healthy are the ones who are best able to work. So um, it sounds like you are challenging the logic of the this approach to Medicaid in the first place.
Absolutely. I mean, when people are sick, they can't work. Getting them well, getting them whatever the treatments they need allows them to go work. I mean, I think he just couldn't really come up with an answer because there is no good answer to it. Because when you take away health insurance, people get sicker, they don't get healthier. And so, like, I used MAHA, the Make America Healthy Again, because that comes from our Secretary of Health and Human Services, Robert F. Kennedy Jr., who is I mean, he's absolutely unqualified to have that job, but it's like, what does he think that we can just give people, spinach and raw milk and a little vitamin A and they won't ever need to see a doctor? Like, it just doesn't make sense. And it doesn't make sense to the American people either. They see right through an answer like that.
Doctors, anything else you think people should know about the markup session and the progress of this effort to change Medicaid and how it's structured in America?
Here's what I want people to know, because we haven't talked about this. Hundreds of people were lined up outside the door of the building. Hundreds of people were inside in the halls. And then as many people as they could pack into the hearing room were in there. Not a single one of them had a shirt or a sign that said, gut Medicaid, tax breaks for the wealthiest. I mean, everybody in there was on the same page and understood the stakes. And I just want people out there to know that their voices matter so much. And so, I mean, you have in me a representative who is going to fight to preserve your health care and do what's right by you. But those of you who might be listening who might have a representative who are not sure if they're going to land on your side or on the tax relief for billionaires side, you need to be calling the people who represent you and letting them know your story and why it matters and how they should vote if they are going to faithfully represent you.
Well, Dr. Kim Schrier, Democratic Representative for the 8th District in the U.S. Congress. Thanks a lot for speaking with me today.
Thank you. Great to see you always.